Hi everyone, welcome to GoLocal Live. Happy Monday afternoon. Hope folks are doing well. You're joining us live from the Warren Alpert Medical School at Brown University with the Director of the Division of Disaster Medicine and Emergency Preparedness, Dr. Selim. Thank you for joining us today.
You're welcome, it's my pleasure.
Well, I appreciate your taking the time to join us here live to talk about the latest coronavirus out of China, of course, getting the world's attention, now the CDC monitoring potential cases, including some confirmed cases here in the United States. So something that you are familiar with, but of course taking a lot of attention from the world. What to know, doctor, about this particular coronavirus?
So this is a novel coronavirus. That means it's new. We've never seen this virus before in the world. And coronaviruses are ubiquitous. They're everywhere, and people get them all the time without getting very sick. It's like having a cold. But occasionally, these coronaviruses mutate, and they mix with other viruses in other animals, such as bats. And then they come back to the human host and wreak havoc like this one. We've seen this before with the SARS epidemic and MERS in the Middle East.
Now, do we know the particular makeup of this coronavirus? You talk about its mutation, if you will. How much do scientists and folks in the medical community know about this particular coronavirus that, again, has emerged from China?
Sure. China has a pretty advanced capabilities in terms of medicine, and they've actually published the genome for this virus. So we know quite a bit about this virus. What we don't know yet is how this virus interacts with the human host to cause disease, and we're starting to get information about that. To date, there have actually been 5 scientific publications that describe this, but it's the early days, and we're learning every day.
And so, of course, you said there are any number of coronaviruses that are throughout the world at any given time, but folks who are concerned clearly about this particular one, there's been some talk that you could be carrying it and not exhibiting any symptoms before you do. So, talk with us about preparedness, talk with us about travel, and of course, when to seek medical attention.
Sure. So to date, this virus is mostly contained within China. There are some cases throughout the world. It's in 4 continents, and there have been 5 confirmed cases in the United States. But all of those cases had travel histories to the epicenter of this virus, which is Wuhan in China. So right now, someone in the United States should not panic, should not worry. It's very unlikely that they will contract this virus unless they plan travel to Wuhan.
And so let's talk a little bit about that preparedness. Now, we've talked to the Rhode Island Department of Health. They are getting the information and being aware as well. How does, as a director of a division of disaster medicine and emergency preparedness, how does this division prepare for something like this?
Sure. We look at the literature, look at what's been done before, and try to heed the lessons from history. This is very similar to the early days of SARS, and we know that was contained using public health measures such as screening, identifying people with the disease, and isolating them. And that's what we're trying to do right now. We're trying to develop screening tools to screen people who have traveled and have symptoms such as fever and cough, and determine if they have this virus, and if they do, we isolate them.
And being here at the medical school, what type of learning opportunity does this present to students to see something real time and ask the questions about all of the issues that you've raised?
So this is a terrible disease that's going around, but as a student of medicine, this is a great opportunity for the students to work alongside the experts in doing this preparedness, and we have students with us that are doing that.
Okay, well, I appreciate the doctor taking the time to join us again. Folks having questions about coronavirus, what to expect moving forward. Anything else we didn't hit on, doctor?
So, if you've been traveling to China, specifically to Wuhan, and have symptoms, Go see your doctor, go to the emergency department if necessary. But when you do that, try to put a surgical mask on and try to self-isolate yourself and, not cough into people's directions. And that would, prevent the spread of not just this virus, but any other viruses. The influenza is epidemic right now and, has killed many more people in the United States. And the techniques for preventing ourselves and others is very similar to this virus.
How effective are masks, doctor?
So there are different kinds of masks. There's surgical masks, and then there are these N95 masks that healthcare professionals use. And even the surgical masks have been proven to decrease the amount of virus that gets spewed in the air when someone coughs. So they are useful.
Okay, well, we appreciate, again, you're taking the time to join us on live. Thank you for watching here again at the Warren Alpert Medical School at Brown University. We'll be back with more live shortly, so when you see us on GoLocal, come over and say hi. I'm GoLocal News Editor Kate Nagel.